Welcome to the STARS program, seniors taking active roles in society. And now, here's your host, ANITA FINLEY.
We're going to do something that's very interesting, robotic surgery. We now use robots for so many things. Of course, we have robots here at the studio. Not really, just kidding. But when you start to talk about medicine, we have someone who just loves to do his surgery, and it's called robotic surgery, and we're going to find out what that means. And it's Vlad Gorbaty, and he is a urologist, but he does lots of things with that specialty. He does specialize in robotic surgery. He works as a part of Broward Health, and Broward Health has lots of hospitals. So I'm glad that you came today.
Thank you, ANITA. It's always great to see you.
Yeah, well, I have to say that men, as they age, they usually used to talk about football, and they used to talk about sports and maybe some other things, but now they talk about their bladder and their prostate. I mean, this is hysterical because this one talks about that part of their prostate. This one talks about not sleeping at night. Things have changed.
Yeah, things change as you get older, but it's what's nice is that guys are actually opening up and sharing this with their loved ones and especially with their doctors. So they're getting brave as they get older to actually confront some of their problems that are bugging them. So it's the frequent trips to the bathroom during the football game. That's
going to get a beer, right? Going to the bathroom,
right? It's the long lines in the bathroom. That's what they're complaining about, and so we're always happy to figure out what really is the cause of their complaints and to try to get them, their family, and their other doctors involved to help with their complaints.
Okay, so let's talk. If someone asked you what you did, why don't you talk about all the various forms of urology?
Yeah, that's a great question because I think people think of, when they think of urologists, they just think of prostate or they think maybe vasectomy or, just one little thing, whereas our field really encompasses a lot of problems, including some serious things like prostate cancer, bladder cancer, kidney cancer, testicular cancer in young guys, but also to the little things like, simple things like a circumcision in a little child, or, what I love about my field is that we can do a lot of things in the office and try to help people with their urinary complaints or do some major surgeries in the operating room. And many of these big surgeries have now transformed from big cuts, kind of like a shark attack cut, to small little holes in the belly. And that's really what I specialize in. We still do the big operations for cancer and other problems, but it's done all through little holes in the belly instead of the big cuts, which leads to a quicker recovery for patients.
And this is like interventional radiology in the sense?
Oh, yes. We oftentimes actually work with interventional radiologists to help solve some problems. And again, it's all done through little either through needles, a tiny needle poke, or through small cuts in the belly. But that's what's changing in our field is not only the kind of treatments we offer patients, but also the approach, the less invasive approaches that allow patients to recover faster and get back to their lives. But I love my field in that we can be helping little babies that are newborn and help. There's certain pediatric urologists that help reconstruct some disfigurements or some things that babies are born with, or some defects in their kidneys and other urinary anatomical problems, to the point where I'm treating guys in their, in centennial guys. I have a few patients that are over 100 years old, and and keep going. And so that's the beauty of our field, is that we really catch and help people throughout their lifetime. It's not just the old guy coming into our office.
That's very important, because I think people see that as a urologist, especially as one ages, but you just were sharing all that. Well, let's go back to the robotic surgery. Why has that been such a great value?
Well, the amazing thing is that the robotics, what is, simply to put it, what we do with a robot is essentially it replicates our wrist motions, wrist movements. Okay, so we're able to place small instruments through the small cuts in the belly, and these instruments are able to move in various ways that mimic our wrists. So if we have these tiny scissors and tiny graspers, and we're able to move them with a joystick, just as if we were holding those instruments with our hands,
which takes a bigger cut,
right? We're able to do a very complex operation that requires a lot of dexterity and a lot of turns and twists of our instruments. We're able to do that with the joysticks that that exactly mimic our wrist movement. And so that it allows us to do our stitching and to our cutting in a very, very precise way. It also eliminates any kind of tremor. It also, the instruments are so small that it allows us to almost do microsurgery in a way, because the robot also has very, very strong lenses that are HD cameras, and they're three-dimensional. So the surgeon actually sees the tissue in a 3D view, as if they're looking at it, instead of kind of like looking through a telescreen, which is basically a two-dimensional view of an object. But this is, a 3D technology with high definition view just allows us to see things that we've never seen before as well in real, open surgery in the past.
I would think it would be very good to eliminate infection.
Certainly the smaller cuts do reduce the risk of infection in the wound, because literally the cuts are at most 12 millimeters long. So that's less than a half an inch long.
And so this is not good, though, for everything. That's good for a certain kind of operation. But,
right.
So what would you use that for compared to just going and doing other kinds of surgery?
Honestly, it's the types of things that we are able to do are almost limitless at this point, except for treating patients with very large tumors, and for instance, large kidney tumors that are maybe taking up so much space that in the belly that there's no point, because in order for us to remove that whole tumor, we have to still make a larger incision. But the thing about, for instance, kidney tumors is that most of our imaging that we do, the CAT scans, the MRIs, all those tests that were not available about 20 years ago, are now widely available and widely used. So we often pick up tumors and cancers and those big problems in patients a lot sooner, a lot earlier. And so we're not really dealing with these gigantic problems to begin with. That's only if patients don't have really access to health care or access to physicians, or really ignore their problems for a long time. That's really when oftentimes we see that the need for open, big surgery. But most of the time, most of the operations can now be done through the smaller cuts. And we just had an update in the type of robot that we have, which has enhanced, the ability to move it around, maneuver it, and do all kinds of new, widen our access to different kinds of operations and techniques that we've not been able to do before. And that robot is now available. It's called the XI robot. It is available at Imperial Point, which I just heard was the busiest place for robotic surgery in South Florida. It's shocking, but it is, it's a smaller kind of a hospital, which is kind of almost a boutique hospital. But that robot is being used pretty much 5 days a week nonstop by all various surgeons, urologists, gynecologists, general surgeons, and same at Broward General. But sounds like Imperial Point is very busy right now.
Right, Dr. Alice Taylor is the CEO, and I'm friends with her, and I know that at one point people were saying, well, it's so expensive, why should we have one? But she bit the bullet, and she's making use of it, and I really admire her for that.
Well, I think she realized that, if the surgeons are well-trained and are excited about the technology, and the feedback that we get from patients is certainly, very positive, and that really what drives our community hospitals is to make the patients happy. That's really the bottom line.
So let's now go to what is more common, the prostate, because that seems to be the big concern of all men. So are there things that men can do so that they don't have problems with their prostate?
That's a common question I get. There's a lot of things that could be done. The issue is that I think it all stems from your family history, and genetics. So you really have to, although it's tough to get the family history from your parents. It's tough to talk to your parents about their medical problems or your great-grandparents' problems or grandparents' problems. But I think it's very important at some point in your life to really say, hey, Dad, what kind of problems have you had? Because you're more likely to develop prostate problems if your dad had prostate problems, especially, let's say, the prostate cancer. It definitely runs in families, and the earlier the father has had prostate cancer, the earlier the son may develop that, and they have to be screened early. Same thing with prostate enlargement and the urinary complaints that guys get. That doesn't correlate with cancer. It's just naturally your prostate grows as you get older. But there are certain things that, besides genetics that can make it worse, for instance. There's some patients that I see on a regular basis that are getting a lot of help from many holistic physicians and many other offices that offer testosterone replacement and kind of feel young kind of types of treatments, okay? And many of for instance, the testosterone and the supplements that help improve your maybe physical condition might make the prostate grow a little faster, because prostate does grow with more testosterone, okay? And so they don't realize that until their prostate is already too big and they've maybe overdone it with the testosterone and supplements like that. And so you really have to watch what the supplements that you take. You got to be kind of cognizant about, not only too much of a good thing, can be very harmful. And so you have to really seek advice from, your family doctor and sometimes us to make sure that these things are okay and that you're not going to lead to worsening your urinary symptoms.
That's a very good point that you bring up, but I want to move further with this because you also see on the internet now about how a man can have a better erection. And, of course, there are a lot of ways now they show you, medication or operations. Or do you have people come in there and they complain that, of course, that now as they're aging, they're not able to fulfill what their lovemaking?
Right. That's every day, on a regular basis. Patients come in complaining of erectile dysfunction. Right. And, again, there are various causes. Majority of the time, it is age-related, and we have 50% of 50-year-olds start to develop some form of erectile dysfunction. Some guys even develop it earlier. And it's similar idea to heart disease, okay? Because the same mechanisms that cause erectile dysfunction, a.k.a. poor blood flow, poor blood flow to any organ is going to cause some sort of dysfunction. So poor blood flow to your heart will lead to a heart attack. So, for instance, guys who are more prone to a heart attack, whether a strong family history, they already have high blood pressure, diabetes, obesity, high cholesterol, those things are set up for a heart attack, but they're also set up for erectile problems too. So It's really not one thing that may cause a problem like that, but it is very common. And that, yes, there are various ways that we help guys. I wish we had something that would reverse the process. Right now, we just like for heart disease, there's not much we do to reverse things except for exercise, healthier diet. It may improve things, just like for the heart, for the erections as well. We see guys regaining their erections just with weight loss sometimes, or diabetes control. But overall, majority of our treatments are really designed to help improve erections, but not necessarily reverse the process so much. I mean, if we could figure that out, we would be very well off.
Yeah, but I think you've explained it very well, because there are a lot of men, as you said, the younger men, and maybe it also helps younger men know that they have something else wrong going with them, too, that it enlightens them and say, you better go to the doctor and see what else it is.
I mean, a guy in their, let's say their 50s, for instance, coming in with erection problems, and they don't have any other medical history, I definitely refer them to their primary to do a heart check, not because I'm worried about their Viagra trial causing some kind of heart issue. I'm more concerned about the process that led to the erection problem, maybe causing other organ damage, like their kidney function damage, or leading to a heart attack.
Yeah, that's good. So my guest is Dr. Vlad Gorbaty. He is a board-certified MD in urology. He also is very, very highly specialized in the robotic surgery. He's with Broward Health. And he is, of course, he's a new father, and that's a wonderful thing. A 7-month-old boy or girl?
Girl.
A girl. And, of course, that may keep you up at night, but we were talking about sleep a little bit. So why don't you talk about sleep and how that affects people who come in and they're not sleeping well, and so they're going to the bathroom all the time, and then they're not sleeping well. One thing goes on with the other. Right.
You just had a newsletter about that problem and the ways to improve people's sleep, and I think that was a very good guide, and it's a great start. But the problem is that it is a cycle. It's a catch-22. The sleep makes your other medical problems, sometimes lack of sleep causes other medical problems to get worse, and then those medical problems can make the sleep worse, and it's just a cycle that's almost never ending and results in a lot of problems in my patients. But oftentimes when I see patients, it's because of their urinary complaints at night. They're having to get up frequently, and that's where the process of trying to figure out what the exact cause is. And it could be a simple thing as a change in their behavior. As guys get older, that one or two glasses of wine maybe their body's a little more sensitive to that extra glass of wine than they used to before, and it's a diuretic, and they would make them pee a lot more than they used to when they were young and having that one glass of wine at night, or the caffeine intake. And so we try to break down their diets, their behavior, their medications, and, of course, any kind of medical problems like an enlarged prostate. But I think one of the biggest causes for urinary symptoms at night is actually sleep apnea. Many guys snore quite a bit at night, and just fixing that problem, which actually is one of the leading causes of heart failure too, is sleep apnea. So they really have to, it's a multi-specialty approach. You have to sometimes have a lung specialist, a urologist, a family doctor, all of us involved in trying to figure out multiple issues that might be leading to that one symptom of getting up at night. So it's not always a simple solution, but oftentimes we figure it out. What it takes is really patience for our patients to have.
I think it's wonderful that you'll do that
approach.
Right. It's not just ho-hum. Well, now we've been talking about men. You're a urologist for women also, aren't you?
Right. And we often treat women, and the kind of things women see us are, range from simple things like kidney stones, which women also get. We have actually almost an equal amount of stone formation in women as in men. And especially in South Florida, that's a very common occurrence.
Why is that?
Well, we are exposed to a hotter temperature, and we may not be hydrated enough. But a lot of times, especially in people with recurrent kidney stones, sometimes it is a metabolic problem. So it's maybe their kidneys produce a little too much of a certain chemical in their urine that makes them more prone to kidney stones. And one of our approaches in our office is really to figure out why they're making a stone. It's not necessarily always about the treatment of a stone. It's also about prevention, and that's a key in kidney stone management, especially in patients who've had more than one kidney stone. Just drinking enough water sometimes is not enough, and we have certain medications and certainly a lot of different diet changes that can improve that. One thing I just wanted to mention, there's a craze of having all these juices, and I know it's really healthy, but a lot of the dark greens like kale and spinach, they can raise your risk of kidney stones. So we have people, going on these crazy diets with juicing and all this stuff where, they're quietly causing a little harm to their kidneys. So
I've never heard
too much
that.
of a good
I'm
thing
glad you brought that up.
Can be bad.
Okay, well, let's cover urinary incontinence because we know that that's a big problem for men and women.
Right. Yes. I touched base on the kidney stones for women, but urinary incontinence is probably the biggest reason women come into our office. And it's sometimes can be a little bit of a convoluted situation, and we have to figure out what the real cause is. But oftentimes it is related to either pregnancies, age, and what happens is many women, it's called stress incontinence. Many women can be coughing, sneezing, and leaking a little bit of urine, whereas some women get what's called urge incontinence, which is basically you got to go, you just can't make it to the restroom, and you leak a little bit. And the ways we treat these kinds of incontinence problems varies dramatically. Whereas in some cases it's the medicines that help, and others it are procedures that can help.
And are you doing those procedures?
Yeah, one of my partners, Dr. Chenven, Eric Chenven, he manages incontinence quite a bit in our office. And, he does those kinds of procedures.
Someone said that Botox is being used for this.
Yes, it is. Really... It is one of the latest medicines that we use, especially in the urge incontinence situation where people feel the urge, they can't make it to a restroom, and that's essentially the bladder muscles spasming and causing a little bit of urine leakage. And as you know, Botox works on muscle. So the way it helps with wrinkles is that it makes the muscle in the face kind of relax, and it's since it's a relaxant of a muscle, we can inject it into the bladder and make the bladder calm down so it doesn't create these spasms and leakage. But beyond pills, that's one of our options for long-term incontinence treatment.
And I want to give our listeners a phone number. I think they can call you at 954-463-6408.
Correct. Mm-hmm.
And they can call for an appointment if they desire to do that. I'll do that again. That's 954-463-6408. And Dr. Gorbati is spelled Gorbatly. I'm sorry. It has. This is like it, right?
See,
right.
when
Gorbati.
you come, our family immigrated from the Soviet bloc, and our sometimes when you translate from Cyrillic alphabet to English, all kinds of letters start popping up.
Right. Well, that's great. Well, but we're glad to have you here because we respect people who are. Sounds like you're very interested in what you do. You're very dedicated. It's you're young, and that's great because you've just you have all the latest information. Someone authored was just here and said he's working on a book of bringing back all these old famous people into today's world and how would they face it? What would they do? So of course the technology is not even to be believed. But tell me what the when someone finds out that they do have bladder cancer, are you able to remove the bladder? What happens?
Well, bladder cancer, it's certainly a very serious cancer, and we don't talk about it much because it is not a very common cancer, but it is probably one of the most serious cancers and probably one of the most costly cancers to treat. The reason for that is it has a very high chance of recurrence. Okay, we do, for cancers in the bladder, which is basically a little tumor that grows in the lining of the bladder. That's essentially what bladder cancer is, and oftentimes if it's small enough, we can scoop it away. We can remove it. We don't have to make any cuts in the belly to do that. Everything is done through natural openings, but it has a high tendency to recur. And so we have to be constantly taking a peek in the bladder to make sure nothing returns. However, when it is more advanced, it is, we do offer bigger operations, including removal of the bladder, which nowadays can be done with a robot, although it's, only very few guys, specialize in doing that with a robot. The good news is that we finally have some newer medicines that are available, newer chemo drugs that weren't, there was a lull in new drugs for bladder cancer for a number of years. We finally are starting to get a new wave of new medicines, new drugs to prevent recurrences. So, do come and hear out what's available.
If you're having a problem in urology, please go and meet with Dr. Gorbatiy, because he certainly is everything that you hear on the radio. He's even more. Phone number again, 954-463-6408. Thank you so much for taking your time to do this.
Always fun.